Hello, I'm Lorraine McMullen, Interim Deputy Director of Operations for Sirona. Thank you for attending this webinar. We will now detail the imminent changes to our referral criteria for autism assessment and our paediatric services and explaining why we are doing this. We will also talk about the impact this will have on our families, our services in the future, and detail how we are letting our partners know. There has been a significant rise in demand and increased numbers of children on waiting lists within community paediatrics and the ASD service. Children who are being currently seen have waited over 2 years for an autism assessment, and children who are now being referred will wait considerably longer. The service is not currently meeting the statutory expectations for our children in care and SEND, and the 18-week targets for new assessment. Compared to other services across the UK, the thresholds of our current referral criteria are lower, and we are accepting a higher proportion of referrals. Waiting list initiatives and non-recurring money have helped to bridge the service gap over the past year. As you can see from these figures and the increasing pressure on our services, doing nothing is not an option. With the support of the wider system, we are changing our referral criteria to ensure most vulnerable children and those children and young people most in need can access our community paediatrics and autism service. This has been a very difficult decision to take. We are working towards a go-live date of March the 1st. The new criteria is a needs-based approach with a robust triage process and has been clinically led. From March the 1st, children and young people will only be accepted into these services if autism is suspected and associated needs are causing the child or young person significant functional difficulties despite wider appropriate support. Children and young people whose referral date was before March the 1st will be seen, and children whose date of referral is after March the 1st will be triaged using the new criteria. The plan. The changes will enable us on improving outcomes for children and young people with the most clinical need and vulnerability, whose condition is having a considerable impact on their daily lives. The new approach will ensure a shorter wait for those most in need. It will also ensure the services meet our statutory and legal responsibilities for SEND and children in care. The new criteria will also offer Bristol, North Somerset and South Gloucestershire more in line with other areas of the country, which will ensure a more consistent equity of access. How will we monitor the impact of these changes? There has been a robust quality impact assessment of the changes to ensure equity of service. This was based on clinical evidence presented by senior clinicians. It has also had formal approval from the ICB. The impact of these changes will be monitored in terms of the number of referrals to these services and other services, such as therapies and school nursing. And we are also developing a reporting dashboard to capture and monitor both the quantitative performance metrics, such as referrals, discharges and caseload, and also wider clinical audits. We will also continue to request feedback from our stakeholders through surveys and focus groups. And we know from our patient carers that families want clear and transparent information, even when it's not the news they were hoping for. We will share the current waiting times and the letters sent to families, and we'll be exploring other ways of making this information available. So from a paediatric service perspective, here is a list of the children that will be accepted onto our waiting list. Education placement breaking down or have a temporary education placement. Children whose family is at risk of breaking down. Children and young people on a child protection plan or a child in need plan. Children in care, including our unaccompanied asylum seekers. Children aged 17 for ADHD assessments only. Children involved with the youth offending team or police. Preschool children with very low levels of communication where autism is suspected. Children who've been diagnosed with attention deficit disorder and are on medication referred for ongoing management. Referrals due to motor function will also be accepted, apart from assessments of developmental coordination disorder or dyspraxia. And we will also see children with a neurodisability with feeding issues or epilepsy, and children with Down syndrome and children with visual or hearing impairment. Children referred for an autism assessment will also be accepted if their education placement at risk of breaking down, despite appropriate support, including those who are not in education. Children whose family unit is at risk of breaking down despite support from appropriate agencies, and where parent carers and social care are unable to meet the child's needs, leading to a risk of a child protection procedures and/or a child needing alternative placement. And this will also include children with adoption if that's at risk of breaking down. Children in care are on a child protection plan where an autism assessment is needed, for example, to inform placement planning. Children who are open to CAMS with severe and enduring mental health difficulties. Children who are engaged with youth offending services or in repeated offending behaviour. And children with low levels of communication where difficulties are likely to be associated with autism, and they're usually early years children. What do these changes mean for children, young people and their families? The service will focus on improving outcomes for children and young people with the most clinical need and vulnerability, whose condition is having a considerable impact on their daily lives. The new approach will ensure a shorter wait for those most in need in the future. However, impact on waiting times will take 2 years due to the backlog. Children do not require a diagnosis to have their needs met in schools and settings, and the wait for the outcome of diagnostic assessment must not delay children receiving that appropriate provision. If a child does not meet the criteria, parents and carers and the referrer will receive a letter containing information about how other services may be able to provide a needs-based assessment, with recommendations on how to meet the child's need without requiring a diagnosis. This could include school, nursery, college, children's centres, health visitor or universal health services. We have new pages on our website to ensure families and professionals can access information regarding support and signposting. How are we informing people about these changes? We're adding clear criteria, guidance and information on our website. This will include this video for our website to explain the changes to our families, along with some frequently asked questions. We are setting up a help desk which will go live as families are informed to enable them to get in touch with any queries or access further signposting support. Every child who has been referred to the Autism or Community Paediatric Service will receive a letter, and we're aiming for this to be in the week commencing of the 20th of February. This will detail the changes and let families know how this affects them. It will also include contact details of the help desk. We are sharing webinars and briefings with partners, including GP schools and SENCOs locally, along with local authorities, parent care groups, to ensure everyone is informed of the new criteria and how it affects their child's referrals. Thank you very much for listening.